Hi friends. Welcome to Dentistry Love Channel. Access Cavity Preparation Part 3. Endodontic cavity preparation may be separated into two anatomic divisions: coronal preparation and radicular preparation. The coronal phase, which is access cavity, must give direct access to the root canals and the apical foramina, so that these areas may be cleaned and shaped by the interradicular phase. Here in the first pic, the position of enamel, dentin and pulp is shown, and in the second pic, access cavity preparation began with the usage of round burr, followed by third and fourth pic, where the roof of pulp chamber is removed. In the fifth pic, evening of walls of the access cavity is done with the usage of non-end cutting burr, and in the last pic, the prepared access cavity is shown. Apical root anatomy. The classic concept of apical root anatomy is based on three anatomic and histologic landmarks in the apical region of a root: apical constriction, AC, the cemento-dentinal junction, CDJ, the apical foramen, AF. Here with the first pic, Cutler's description of the anatomy of the root apex has the root canal tapering from canal orifice to the apical constriction, AC, which is generally 0.5 to 1.5 mm coronal to the apical foramen, AF. Here in the second pic, we can see accessory and lateral canal. Accessory canal is any branch of the main pulp canal or chamber that communicates with the external surface of root. A lateral canal is an accessory canal located in coronal or middle third of root, usually extending horizontally from main root canal. Accessory foramen and apical foramen is seen. Apical delta is seen, which is an intricate system of spaces within root canal that allows free passage of blood vessels and nerves from the periapical compartment to the pulp tissue. Principles. Outline form. Establish outline form evolves from the internal anatomy of the tooth established by the pulp. Convenience form. It makes more convenient and accurate preparation and filling of root canal. 4 benefits of it includes: unobstructed access to canal orifice, direct access to apical foramen, cavity expansion to accommodate filling techniques, and complete authority over enlarging instrument. Removal of remaining carious dentin and affected restorations. Toilet of the cavity. It is aimed to remove debris, dentin chips, saliva. Improved adaptation of final restoration. Hinder recurrence of decay. The cavity should be clean and dry before insertion of final restorations. Laws of access cavity preparation. Law of centrality. Floor of pulp chamber is always located in the center of tooth at the level of siege. Law of cemento-enamel junction. Siege is the most consistent, repeatable landmark for locating the position of pulp chamber. It is explained in the pic. Law of concentricity. Walls of pulp chamber are always concentric to the external surface of the tooth, at the level of siege. Law of color change. Color of pulp chamber walls are always darker than walls. Here it is explained in the pics. Law of symmetry. Except for maxillary molars, the orifices of the canals are equidistant from a line drawn in a mesial distal direction through the pulp chamber floor. Law of orifice location. It is located at the junction of the walls and the floor, at the angles in the floor-wall junction, and at the terminus of root developmental fusion lines. Thank you friends. Please do subscribe for more videos.